Good afternoon, and thank you for joining us today. I'm Mark Seifert, Solutions Advisor for focusing on the healthcare industry for the Wisconsin School of Business Center for Professional and Executive Development, or what we like to call CPED. Excited to have you all with us today. Before we do get started down the path of strategy and hand it over to Ann Martel, I'd like to share a few words about what we do here at CPED. So, Ann, if you want to flip to the next one. So CPED offers programs and certificates that will give you the modern, relevant skills needed to advance your career. All of our programs offer interactive learning sessions facilitated by instructors with practical business experience. We also partner with organizations to provide customized professional development programs, coaching, and consulting. In that instance, we work with our client partners to develop sessions that tie to specific organizational methodologies, strategy, culture, and business goals. So if you want more information or like more information on CPED, please do visit our website at uwcped.org. Next slide. If you have any questions during today's webinar, please submit those using either the chat or the Q&A buttons on the bottom of the webinar screen. We will pose those questions during the Q&A at the end of today's webinar. And I also want to mention that the webinar today is being recorded, and a link of the recording will be made available within the next few days. So now a little bit about our facilitator today. Ann Martel has served as CFO and controller to a wide variety of organizations in the healthcare industry, including Anthem WellPoint, Commonwealth Medical Group, Attic Angels Senior Community, Wisconsin Breast Cancer Coalition, and Oakwood Lutheran Senior Ministry. In addition, as the Assistant Medicare CFO at National Government Services, one of the largest Medicare contractors in the U.S., Ann had the opportunity to see healthcare from all different angles. We're fortunate to have Ann as part of our instructor team at CPED, and thank you for being with us today, Ann. I will hand it over to you.
Thank you so much, Mark, and welcome, everybody. I'm very happy to be here to share some insights that I've secured over the years, both from my professional experience as well as interacting with a variety of people through the various programs that I handle at CPED. Today, we're going to be talking specifically about strategy, and in particular, strategy when it comes to a healthcare system. So I'd like to start out our time together with just some basic ground foundational concepts of what strategy is, because I think there's a lot of terms that get interchanged and used as a replacement or mean the same thing sometimes in your mind when you're thinking about strategy. But it would help if I would go the right way. Strategy in and of itself, it's a plan of action. It's a policy. And one of the things that differentiates strategy from all the other terms that I'm about to show you in a minute is this idea that strategy is about achieving a major or overall aim. Whether it's developing an economic strategy, it was used originally in military, the strategy of how to win the war. That's where strategy really came from. And when you're looking at strategy in a business organization, you're really trying to accomplish either operational effectiveness or efficiency. Strategy, it's looking to the root of the problem. So you always have this unending quest in an organization to become more productive, to speed up your process, to deliver higher quality care, to achieve better patient outcomes when it comes to the healthcare system. It spawns all these different management techniques that you hear about and that countless consultants have written about, but it can't be translated into sustainable profitability unless you've got a good strategy, a strategy that's going to allow you to develop maybe a sustainable competitive advantage. And there was an article that was written back in 2022. It was a white paper put out by Partners Health Group. And one of the things that was identified, and I'm going to read it so I don't mess up the quote per se, is that today's challenge for the healthcare system executive is to plan for a future in which operating margins face continuing compression, so they're getting narrower, Ann's insight, and non-operating margins rely on an aging bull market. Getting it right will be important for patient care for decades to come. So choosing the right strategy in a healthcare system is an important consideration for the future of your organization. Now you get these terms: mission, vision, strategy, goals, tactics, objectives. Interchangeably, they could be used and have very, very similar meanings. But strategic business objectives or strategy usually is that much higher level. It's looking at a much higher level or broader objective. Whereas your goals are more tactical. Those are the tactics and the goals to achieve the strategy. So when you're thinking about strategy, the focus is on where are you headed. The tactics and goals are how are you going to get there. So in simplest terms, strategy is how we win. Strategy itself, when you're having a discussion about strategy, you can outperform your rivals. You can outperform other healthcare systems, competitors, and you can win if you establish some sort of difference. Sometimes the difference is fleeting, but oftentimes that difference can be sustainable. It can be preserved. You can be the leader in heart, or you can be the leader in brain, or you can be the leader in cancer or orthopedics. Maybe it's a specialty, or maybe it's a delivery modality that you have the competitive advantage on. But the bottom line, whether you're a healthcare organization or not, is you want to be able to deliver great value to your customers or your patients. Or you want to develop some sort of comparable care at a lower cost, or maybe even both. And I think some of the disruptions that we're going to see in the healthcare system marketplace over the next few years are going to come in this second area of creating value at a lower cost. I think we're going to see some new alternative competitors, even more than we have in the past 5 to 10 years. You're going to see more of like a big organization like Amazon, trying to get into and get a piece of the healthcare market, similar to what Walmart has done or what Walgreens has done by expanding from just a pharmacy into, hey, this is where I can get some basic healthcare in addition to just picking up my prescriptions. So delivering great value allows a company, a non-healthcare company, to charge higher prices. This gets a little more complex in a healthcare system because of the reimbursement contracts that you have to be involved in. It's not like, hey, I have the great tennis shoe and I'm able to charge $20 more per pair of shoes because I've got that swoosh on my tennis shoe, and everybody wants my Air Jordans, or, oh boy, I'm a boomer now. I can really, I'm aging myself there. But in reality, the traditional developing that competitive advantage so you can charge a higher price is a bit more challenging in the healthcare environment because of the payer mix. So what's the process? What's the process for setting forth a strategy? And it's a 3-step process, and the steps aren't in order. So the first step in a strategic process is figuring out, where are you at right now? Where is your organization? Where's your healthcare system right now? And it involves an honest assessment of what's currently happening. What's currently happening at your organization? What's currently happening in the healthcare industry? And what's currently happening in your market, whether it's your geographic market as well as your demographic market. So having that honest assessment or that honest appraisal is always the starting point. Too often I've seen organizations move to step 3. Where do we want to be? Where's our strategy? Where's our strategy built on our mission and our vision? Where do we want to be? And you forget about, if you don't know where you're at right now, you aren't going to know how to get there. You aren't going to know how to get to step 3. What are the initiatives and tactics that we're going to deploy in order to achieve our strategy, in order to arrive at our strategy? So, assessing where you're at right now, determining where we want to be from a sustainable competitive advantage, something that will help us be successful for the long term. That's that's important, those two bookends of the process, so that we can eventually get back to step number 3, setting out those initiatives and tactics that give you the best chance of getting there. Strategic objectives, a strategy, a good strategy is focusing your organization on where you're headed. It ensures that those resources that are very limited in the healthcare environment and the healthcare industry are focused on what's going to be your key tactics for your success. So, good strategy will help your organization respond effectively, and especially in situations where you've got a lot of change. It could be changing market conditions, changing demographics, disruptive events, all of those things that we call the VUCA environment. So, my picture here is a picture of the old yellow cabs. And if you're in the transportation, moving people around, taking people from the airport to the hotel, and you've had your taxi, and the taxi company has that agreement with the county that they're going to run all the taxi services from the airport going anywhere that those passengers want to go. And all of a sudden, this comes along, and we've got Uber. Uber was definitely a disruptive competitor entering that marketplace. And it really highlights what happens to strategy, what happens to performance, but really what happens to strategy when you're in a VUCA environment. So, VUCA environment is the ability to change on a dime, to pivot, whatever term you want to use. And part of the problem today is we think that we can't do this, we can't respond to disruptive events because we don't have enough data. When in reality, ambiguity, as Paul Gibbons says, is not a lack of data, but a deluge of data. So, what does this mean? VUCA is an acronym for volatility, uncertainty, complexity, and ambiguity. And why is it important in a strategy process? Because we have found that the pace of change, not just in the healthcare industry, but across the board, a good strategy is good for maybe a year if you're lucky, because things are changing so fast from a variety of different perspectives. So, being aware and building VUCA, this concept of VUCA, into your strategy process is an important aspect as you're thinking about, well, where do we want to be? What's our strategy going to be for our particular organization? So, I want to take a moment and just outline what VUCA means. So, volatility. What does volatility mean? So, volatility can come from a variety of different places. Volatility just means changing. Things are changing very rapidly in your market, as far as what's going on from a demographic perspective. It could be technology, especially AI. In the healthcare industry, what's going to be the impact of AI? How can it best be used? Remember, if you're trying to develop that competitive advantage of delivering more value for maybe a lower cost, are there things where artificial intelligence can be used effectively? The concern there is the validity of the data in AI. Because healthcare industry, it's not like using AI in developing a training program. If I develop a training program and I'm using some AI examples to develop a case study or something like that, I'm not going to kill somebody. But in healthcare, if you're using AI to help with diagnostics, it can return something that might not be valid. So there's always that risk. Geopolitical events, things that are going on geopolitically right now that could have an impact on the success of an organization's strategy. What's going on in the economy, both domestic and international. The U of VUCA is talking about uncertainty. And it's a little bit different than volatility. Volatility is like changing in the stock market. What's going on in the stock market, going up or down? What's going on in interest rates, going up or down? How hard is it? How difficult is it to access capital or money that you need to run your organization? Uncertainty is different. And in the healthcare industry in particular, the uncertainty surrounding regulations and compliance is one of the biggest challenges that you face. You could have the best strategy that you're going to do this and you're going to implement these new things, you're going to grow these new revenue streams in order to provide this value and develop that competitive advantage. And something could change from a regulatory standpoint that throws everything off the board. We're in a position where in 2 weeks or less, we're going to have a change in the government, or we're going to have a change. It's whether Harris or Trump is elected, it's going to be a change. What does that mean for your strategy? What does that mean for your industry? Having that crystal ball, it's pretty foggy right now with regards to what's going to happen in the healthcare systems within the United States. Competitors, where's the next competitor coming from? Is it somebody like Amazon? Is it somebody like Walmart? Where are you going to be competing head to head, or from a complementary type of a competitor that you haven't even seen? The taxi service versus Uber, perfect example. Changing customer, maybe not tastes and needs, but changing customer demographics in your organization. Obviously the boomer generation is aging, and the impact on that I've seen in the healthcare industry, whether it be at Medicare all the way through senior living, is how can we best deliver good care to the aging population, which accounts for such a large portion of our healthcare costs. It can also be attributed to, about 80% of our healthcare costs are the result of about 20% of our population. And how do we best address those needs of that particular area? Or it can be health equity. How do we ensure that varying challenged demographic groups are getting access to the healthcare that they need? We can have another pandemic. We can have another disruptive event that can turn healthcare on its side. So all these aspects are aspects of uncertainty, and they've always been there. It just seems that they're a little heightened more right now in the last few years, and going to be in the next 5 to 10 years. Complexity is the C of VUCA. Healthcare is a complex scenario. Delivering healthcare, delivering quality healthcare is a challenge. It's a challenge in a metropolitan area, in an urban area, making sure that health equity is addressed, and people of color or people of disadvantaged means have access to good quality healthcare. Same challenge out in the rural environment in the United States. How do we ensure that there is healthcare availability in the rural areas of our state and of our region and of our country? One of the things that I struggled with when I was the president of the Wisconsin Breast Cancer Coalition, is having access to mammography, having access to, we were advocating for dense breast screenings. Well, how do you get that for somebody who might live in rural Wisconsin? It's a complex environment in the healthcare industry. Add to that global markets, which may or may not impact a healthcare organization that's located in Wisconsin or in the United States. But the global markets for products, for the global markets or suppliers for some of your medical equipment or your pharma type things, that can provide an added layer of complexity to your operations. Supply chain challenges. We've seen the disruptions in the supply chain over the last 5 years. Mitigating the risks that come from all different areas: patient safety, quality of care, reimbursement models. All of those things are risks that can definitely impact the strategy of a healthcare organization. Complexity also can be looked at from kind of a global perspective also, in that If you are in a global environment, if you're a global organization, cross-cultural communication adds that additional layer of complexity. The companies that are true global companies. I do a lot of work with Abbott, and they're in 160 different countries. Being able to enhance employee communication during that time is a complex challenge for them. For any healthcare system, the complexity of getting good staffing, getting good clinical staffing, but staffing across the board has been a challenge in the healthcare industry. And then finally, ambiguity, A of the VUCA. When we're thinking about strategy or strategic decision making, we often think about, well, what's the next new product? What's the next new value? What's the next new value-added service? What's the new market that we could get into? And there's some ambiguity about what might be the best priority for your organization. There might be mergers and acquisitions, as companies try to develop that bigger value or better value for lower cost. Is there a trend towards companies consolidating and getting their economies of scale? Ethical questions and the validity of that data and artificial intelligence. Are you on board or are you not? It's an ambiguous question. So all of this time, trying to develop a strategy that incorporates all these aspects of VUCA. You're never going to be perfect, but having the awareness of what could be changing in your industry will help you set a better strategy. And it isn't just strategy at the top leadership. Back in the past, it always was, oh, strategy, the big mucky mucks, the C-suite sets the strategy, and then we kind of just all follow along and set our goals to accomplish that strategy. But encouraging the mindset of people working together, collaborating all of the time will help an organization develop the agility that they need in order to address the rapidly changing world. Now, one last thing about strategy. Strategy is, in my opinion, it's a leg of the business acumen stool. Business acumen is quite often thought about as, well, that's financial stuff. That's financial literacy, financial acumen, etc. It's not. Business acumen is combined of three things: strategy, market, and financial. It is a component of it, but it's not everything. So in an article that was written by Harvard Business, they talked about business acumen. And this was not, it was not related to healthcare, but it was just kind of a generic type of an article. How do you as a leader level up your leadership skills? And one of the statistics that was cited in this article was that businesses are struggling. They're struggling to keep up with the digital transformations. And, that's whether you're a healthcare system. I was dealing with credit union earlier this week. Just the digital transformation and the impact that that's had on delivering care to patients or delivering services to a banking customer. 50%, 7% of global leaders report that that's a struggle for their organizations. Organizations are trying to get flatter. They're trying to get to a structure where a decision can be made faster. And customers have more options than ever before. I love this stat from Amazon. There's 353 million items, the number of items that Amazon algorithms shift through in order to curate different options. If you're out there I'm looking for a new pair of slippers, and it's going to go through all these algorithms to present to you what's going to show up on your search page. So business acumen, understanding how your business works, is more than just the ability to understand financial statements. So strategy of the one leg of the business acumen stool is looking at what's the best way to do something in my organization. There might be 10 different ways to do something, that, as this quote states, 8 of them are fine. 8 of them would be good. Which one is going to be the one you choose? What strategy are you going to pursue? And the quote says, "What option makes us different? What decision delivers more value for the company and our customers?" So as you're thinking about strategy in a healthcare environment, it's always that question: what's going to deliver the best value for the patient? That's your consumer. What is it? Quality of care? Is it monitoring and mitigating healthcare costs? It, I mean, as for the health of your healthcare organization, you want to get reimbursed in order to stay alive. But when we're thinking about value, you're thinking about your patient in mind. And it's critical at every level of leadership. So I just have a slide in here, and you'll see it, if you redo the webinar broadcast, and I know you're going to want to watch it like 5 or 6 more times. But I always like to put this little slide in there because quite often, as I said, we think that strategy is way up here. And I want to get on my soapbox and say strategy, while it may be approved or set at the C level of an organization, it truly permeates every layer of an organization, from the individual contributor who needs to know what's our strategy. How are we going to create value for our patient, and where do I fit in? How do I contribute? To the manager, like thinking about strategy. Okay, I know my business, my organization's strategy. How can I help my team contribute? And then finally, up to the director or the executive level. How should we prioritize our initiatives? How are we going to achieve our strategy? So strategy is not a top level only type of a process. It permeates every aspect or every level of an organization. So what does this mean for the healthcare system? When you think about strategy and you think about it for your own system, I've got my CFO hat on. I was a CFO at a couple different senior living communities. I was the CFO when I was at Commonwealth. We were a group of family medicine and internal medicine and family practice doctors, that offered ancillary services, et cetera. When I'm in, have my insurance or my Medicare hat on, what does strategy mean for a healthcare system? Now, there's several different things right now that are impacting strategy within the healthcare environment right now. There are mergers and acquisitions. There are situations where we've got companies, healthcare systems buying up smaller healthcare systems and becoming bigger ones. We've seen it in Wisconsin. SSM, Freighter, University, all the organizations that are growing, their growth, maybe their model is to reach more, their strategy is to reach more patients and to grow their business. Well, how are they going to do that? How are they going to achieve that strategy? Well, maybe they're going to do it through mergers and acquisitions. So mergers and acquisitions, important aspect. Revenue diversification. So a strategy that's looking at how can I be maybe less reliant on the payer model and more reliant on different streams of revenue generation. The white paper that I started out with, where I was talking about the importance of where our healthcare system's generating new revenue. In that study, there were 3 main levers of revenue diversification that were explored: bringing care model innovations to market, transforming cost centers within the healthcare system to profit centers, and finally generating royalties from drugs, devices, and diagnostics. And so there's several options within there, and there's a lot of different examples that are currently floating around that are good examples of how healthcare systems diversify their revenue. It's more than just improving your revenue cycle. It's more than just improving your payer mix. It's really thinking outside the box from a strategic point of view of what can we do to start getting other types of streams of revenue. Looking through and finding continued efficiencies within your strategy of your healthcare organization. What types of efficiencies can I generate through automation or artificial intelligence? I've read a lot of studies about using artificial intelligence to do some of your basic diagnostics, whether it's reading a straightforward mammogram. Um, I know in the senior living community, when I was the CFO there, utilizing automation and utilizing technology to help with monitoring a senior. This thing's lovely. This lovely little thing that you wear on your wrist, that can be used in senior living to determine, hey, has grandma moved in the last 2 hours? If grandma hasn't moved, or if something's happening with grandma's respirations or heart rate, I need to go check in on grandma. And so it gives you, some monitoring capabilities. Or I was at a trade show once and looking at all the new bells and whistles that were coming up, and there was the toilet seat that would do a urinalysis. When grandma or grandpa went to the bathroom, you could get a urinalysis from that. So utilizing not just efficiencies, but utilizing technology to really improve not just your cost structure, but also your care that you're providing for your patient or your residents. Increasing your delivery options. I think this is going to be also imperative, not just on outpatient care, the focus that we've seen on outpatient care, but I think this one's an important one in the strategy, if you're pursuing a strategy of building your health equity, improving your access to traditionally challenged demographics. Increasing your delivery options would be an important part of the strategy there. One of the aspects that have been looked at from a revenue perspective is utilizing some specialty pharma services, using that as a revenue stream. Software platforms for patient engagement. There was a study that was put out, it was probably 2022, I want to say. I don't have it right here in front of me. But it was a study that was looking at, for patients that are discharged from the hospital and you want to do some follow-up monitoring on them. Traditionally, maybe somebody has called them, call, hey, did you take your blood pressure today? Did you take your meds today? What's your heart rate today? What's your respirations today? And in that study, it said it usually takes at least 8 attempts to contact somebody to get that follow-up information. And what's the better, they were touting a better way of doing that, is using a portal or a patient app, where the patient reports their vitals into an app structure, and then follow-up contact only has to be where there are issues of that something's going wrong. And obviously, it's a challenge. It's based on demographics. There are some demographics that are going to be much more comfortable using an app. Traditionally, it's thought to be the younger generation. But I know for myself, I'm a boomer, and while I'm not as tech savvy as my kids, I enjoy having an app. I enjoy communicating with my provider through an app. I enjoy being able to see my test results on my chart. I enjoy being able to take control of my care that way. So those are some options from a strategic standpoint of building your outreach and building quality of care. Maybe, accelerating your value-based care models as we move into, changing regulations and changing compliance. Value-based care is going to be, it's still there. Not so much emphasis on the traditional old bundled payments. You're going to get $20,000 for a hip replacement and that's it. But it's morphing into some different things. So how is your strategy going to keep up with that? The shift of the payer mix. What's going to happen again? We've got that election coming up in a couple of weeks. What's going to happen with government reimbursement? Is there going to be a shift more to a government-sponsored payer mix, whether it's Medicaid, Medicare, veterans, or something else? What else is coming? That's something that I think you want to be aware of as you're setting your strategy. Healthcare organizations are struggling with setting strategy because they're still dealing with some acute labor shortages. There's still remnants of the COVID-19 pandemic. How is that impacting your healthcare system? Inflation. I mean, inflation doesn't just impact individuals, it impacts businesses. The cost of medical supplies, how are you keeping that is your second biggest for a healthcare system, a hospital, that's your second biggest expense is medical supplies. So how do you keep the costs down? How do you maybe implement some of the old concepts from manufacturing, Six Sigma, lean, making sure that you aren't wasting medical supplies, that the medical supplies that you're ordering, you order them when you need them, you don't stockpile them, and you're getting the best cost for those medical supplies. And obviously, inflation is impacting and putting that upward pressure on wages. So how do we address that from a staffing perspective? We've seen over the past few years that huge uptick in using, traveling nurses or the access to RNs has been very challenging. So a lot of organizations have had to use temporary or traveling types of limited term type engagements, which traditionally are much more expensive. So your overall staffing compensation model is going up as well as having to utilize some non-traditional staffing methods. So struggling with those types of issues, that is going to impact what type of strategy that a healthcare organization is going to set. Margins are still lagging behind pre-pandemic margins. Your operating margin, looking at the difference between revenue and what it costs you to operate your system. So that's why there's also that added emphasis on finding different revenue streams. A successful strategy. How does a successful strategy look like? A successful strategy will focus on your core business. Where do you really excel? And that's part of that strategy process of where are we right now? Having the discipline and the focus on your core business, identify where you really excel and then focus on it. Really maximize your return from that in your strategy. Aim for customer loyalty instead of customer satisfaction. I know HCAHPS scores talk about patient satisfaction and where does it come from? But think about it more from a little bit of a different perspective. Patient or customer loyalty. How can I better serve my patient when and where they want to be served? Patients, as I said, they're becoming more and more tech savvy. They want ready access to their information. They want that on-demand service. They want evidence-based care. They might be in a situation, especially if they're in a high deductible or a health savings type of an arrangement for their care. They might want more transparency, more cost comparisons. I remember I was in the early stages of, I signed up for an HSA when they were first out, and my daughter had to have wrist surgery. And I called the healthcare system. I go, how much is it going to cost me? And I couldn't get a clear answer. That was many years ago, many years ago, but it's still a concern right now, that transparency and what does it cost to provide that care? And you need that to be able to address spiraling medical costs. And spiraling medical costs, well, it's kind of that catch-22. What's the impact of inflation? And is our strategy to be cutting edge? If you want to be cutting edge in the newest technology, that's going to cost money. And that's medical cost, adds to the medical cost going up. Making sure that an alignment and engagement occurs across your organization, that different levels of strategy, that people are aware of where you are developing your competitive advantage. What are you going to be offering to make you different than your competitors in your market? This one is often overlooked, and it's sometimes the downfall of even the best strategy. What's success? Being able to articulate what success is. what success is. Is it margin? Is it patient satisfaction? Is it quality scores? Is it 5-star rating? What is it going to be? And then how are you going to track process in that? Flexibility, being nimble, being able to address those VUCA challenges in any organization, but especially the healthcare systems. Use your data successfully, have the data that you need when you need it to be able to pivot. And all of this ties kind of back to that biggest challenge in managing your costs. Meeting and exceeding your patient needs is always going to be probably one of your ultimate strategies or goal or strategic objective, whatever you want to call it. But cost is still the number one issue that's facing policy regulators, policymakers. It's facing, obviously, companies, it's facing families, it's facing individuals, it's facing insurance companies, payers. It's a big deal. So becoming part of the solution to make healthcare more affordable, to reduce that cost of providing care is a very it's a good strategy. Could be part of a really good strategy. And then finally, looking at your employees. And will this strategy empower employees to fulfill their purpose? Obviously, people get into healthcare as a profession because of a variety of different reasons. But ultimately, they want to provide good quality care to their patients. They want to help. They want to be able to do that. And that's their mission. That's their personal mission. And so they align themselves with an organization that supports that mission, that leads the way on that mission. Now, it sometimes can be the struggle, especially in working with employees of a healthcare system. I'm thinking about a program I'm going to be delivering next month to a large healthcare organization in Philadelphia, where understanding that the alignment of the mission, it's great, but there's also that the old cliche, no margin, no mission. Healthcare is still a business. So also assisting your employees in understanding, not just empowering them to achieve a certain goal or a mission, but also understanding the business aspect of healthcare. It shouldn't be a dirty word. You want to be sustainable from a financial perspective too, so that you can be there to provide that quality care to your patients, to your residents, to your consumers. So kind of balancing that need for the mission, the alignment of the mission, and also the reality of the business aspect of your organization can really engage people. The employees can see where they contribute not only to the social mission, but also to the success of the organization. This was a quote that I really thought was valid or interesting for our time together. And it was from this chief strategy officer at Baylor Scott and White Health. And Levon says, a successful strategy does not create silos, and it ensures everyone is pulling in the same direction. That's why I think the alignment of your employees, the empowerment of your employees is, I listed it as the last bullet point. It's probably the foundation of a successful strategy. Now, a successful healthcare system strategy can help your organization. It can help anticipate changes that are coming down the road, trying to predict those disruptive events. A successful strategy can help you meet your community needs and address those health equity issues. A successful strategy can help you remain competitive with other healthcare providers, including new ones that are coming into the industry. A successful healthcare strategy can hopefully help reduce the cost of providing care. That alignment, a successful strategy, aligning not the organizational goals with all of the stakeholders, not just financial, is the foundation of a successful strategy. And using your triage concepts, what's most critical in achieving your strategy? What's the most critical priority that you want to set in a strategy? And where might be potential investment needs? And by investment, where do we need to spend money to achieve some of our strategies and some of our goals? When we think about a healthcare system and we think about strategy in a healthcare system, it comes from a variety of different ways. The four main pillars of strategy within a healthcare system: clinical, financial, policies, and operations. So your strategies, when you're thinking about setting a strategy for your organization, obviously you want to address you might have a clinical strategy or a clinical objective. Operational types of strategies, whether it's workforce optimization, whether it's your patient throughput. Do I have a bottleneck in the ED? What's my surgical optimization? Scheduled surgeries versus on demand or emergency surgeries. Policies, what's happening with Medicaid, Medicare, your commercial, what's happening with the uninsured population. Looking at the financial aspect of your strategy, the revenue cycle, cost optimization in your cost reports, what you're submitting to Medicare at the end of the year, supply chain evaluations. So all of these are components of strategies for a healthcare organization. In our last few moments together, before I open it up to some questions, strategic planning in healthcare does differ in many ways, but the four main ways that it differs from other fields is that whole sea of the VUCA, complexity. The environment that the healthcare industry is in is a complex environment. You got a bunch of regulators, you got a bunch of regulations. Every regulation, every payer is different. You've got multiple stakeholders, drastically differing needs. It's a complex business model. You've got productivity challenges in the healthcare system. What's the right care? How do we make sure that we've got ourselves with the right resources in the right place? And again, think resources beyond staffing, resources of medical devices, medical equipment, capacity, high degree of uncertainty, the U of VUCA, technology, changing policies, patient demographics, new competitors, etc. And then some of the ethical impacts of your strategic decisions. You're going to decide to maybe provide a different strategy in end-of-life care. What's the ethical or the consequences of changing that type of strategy? And I wanted to share a case study. And this was the American Heart Association. They had a strategy that was set. It was set back in 2018. And their strategy was designed to align with their mission. So their mission, pretty broad-based. We want to advance the health of all individuals and communities. Okay? So mission's kind of out there. What was needed is they needed a good strategy. They wanted a strategy to help achieve that mission. They wanted it to be ambitious and they wanted it to be attainable. All right. So they set forth this comprehensive strategic plan. Their mission, or I'm sorry, not their mission, their strategy plan, I almost tripped my own self up there. Their strategic goal was to reduce the incidence of heart disease and stroke by 20% in 2 years, improve the cardiovascular health of all Americans by 20% in 2 years, and to increase the number of people who receive CPR training. So that's their strategy. Here's where we are now. Here's where we want to be. This is where we want to be. Now, how are we going to get there? That's the middle part of the sandwich. That's the tactics and the initiatives. For the AHA, American Heart Association, their tactics included securing research funding. They wanted to get research funding The research funding was to better develop and better understand the causes and the potential treatments in the care community for cardiovascular disease. By investing in that research, the AHA could advance the field of cardiology. They could help in that field and develop new therapies. Another tactic that they did was educational, educating people about heart health, developing a program that addressed the reality that many people were unaware of heart risks, and the risks of heart disease. Certain demographics, certain behavioral patterns, certain genetics, all the roles that those play in heart disease. And then promote policy that encourages better health, whether it's starting at school-age children with nutritional programs, all the way to access for safe places to exercise. And then finally, they deployed a tactic that was all about advocating and advocating for policies that support these types of improvements to heart health. Again, school nutrition programs, getting access to monitoring devices, getting access to EKGs, etc. So metrics were tracked. There was a system that was developed to determine the success of their strategy. And by doing so, they made significant progress towards their goals. They managed to improve and reach their strategic goal, but they also determined that they needed continuous improvement. The 20%, it was great, but now let's keep going. And so their strategic plan focuses now on continuous improvement. So just an example of a healthcare organization that had a successful implementation of a strategy over a 2-year time frame. One more quote from Baylor, Scott, and White Health. Great organizations never forget why they exist and why they make the choices they do, even when business as usual gets turned on its head. And I think that's where we are right now in the healthcare industry. Business has been turned on its head, and it will continue to be on its head. How your organization reacts and the strategies and tactics that you set to achieve those goals will be ever changing. Last comment from my friend Steve Jobs, not my friend, I'm just kidding. Deciding what to do, what not to do is as important as deciding what to do. So in our last few minutes together, I think we've got some chats. So Mark, if you could help me out and tell me what we got in the chat.
Yeah, thank you, Anne, and thanks for giving us a lot to chew on when we think about strategic process. And thanks everyone for attending today's webinar. Please do put any questions you have into the chat or the Q&A box. Before we get to those questions, though, I just want to let you know that we're here and ready to help you, your teams, and your organization evaluate and further develop your business strategy. I would love to set up time to talk, learn more about your organization, and share how we've partnered with others as they develop and execute on their strategy. So you'll see my email on the slide, mark.seifert@uwcped.org, and look forward to further exploration with you. So let's see. I think I just lost my. So Anne, you sprinkled in competitive strategy or competitive. Discuss competitive advantage a lot, and healthcare organizations are, of course, completely. They compete differently than most other organizations. Its profit and patient outcomes are kind of interdependent. So how can you talk a little bit more and maybe how healthcare systems develop a competitive strategy? Any more thoughts on that?
Yeah, absolutely. The developing that competitive strategy is it's kind of a two-step process. The first thing that you want to know is you want to identify what your value proposition is. What are you able to bring to the table? And within the healthcare market, as you said, it can be different. It's different than somebody like Amazon. Amazon is looking at distribution channels and product mix and all of that. But it's also kind of similar to Amazon. What's your distribution channel? How are you going to get your healthcare to your patients? What's the quality of the service that you're providing? And how do you do things differently than another organization? Is there a specialty or an area of focus that you do differently? Or is there something that you offer that nobody else does? So what do you do differently? Or what do you offer that somebody else doesn't have or that is in scarce supply? Being able to do that is one of the foundations of developing a good competitive strategy or competitive advantage. The other thing is knowing who your competitors are and not just what they do well, but how well you can utilize your internal resources effectively to compete against them, whether it's delivery of care, whether it's we're able to handle trauma, level 1 trauma. We're able to provide maybe more charity care because we've got this really great foundation, and they're able to provide reimbursement to us, so we don't go, we don't go belly up. And that's a good advantage that another system may not be able to do. So it's really about what your value proposition is, and then looking at your competitors, figuring out who they are, not just right now, but who they might be, and how do you stack up in resource management versus them.
So yeah, and understanding your competitors, you also talked about in the webinar today about assessing where your current state is and the importance of where you are now, and maybe not always understanding where you are, maybe as it relates to the industry, as it relates to your competitors. So I will end with this question.
Yeah.
What part, and maybe this part, it may be a depends answer, which part of the strategic process is most important in your mind?
I really do think that figuring out where you are right now is a good starting point, because it really does require you to think about where your value is in an organization, as well as the resources that you have, people, equipment, capacity, foundation, what's your current payer mix, all of those things. Where are we right now? And then, and sometimes it's the old SWOT, strengths, weaknesses, opportunities, and threats. It makes you think in a very objective manner, looking at your business from a 360 perspective. And I said it's important to do that, because if you just set a strategy without knowing where your starting point is, you don't know how to get to your ultimate strategy, because you don't know where you're starting from. And that's getting those tactics and those initiatives. One of the things that if you go to my business acumen and strategy class that we do it is called a TOES matrix, and it's just SWOT in reverse, and it's looking at how you can utilize your strengths to maximize your opportunities, or your strengths to mitigate threats. And it's one of those tactics or tools that you can use in the strategic process.
So there was just a drop in the chat. SWOT is an acronym for just really assessing your strengths, your weaknesses, the opportunities, and threats in the market. Do you want to? Is that anything more you want to add other than that? It's just an exercise to really get all that out on the table.
Yeah, it's an exercise to help you assess where you are right now.
Yep, perfect. All right. Well, I want to thank you so much, Anne, and thank you all that attended. We do, I want to just encourage you to please go to our website at uwcped.org. We do have a resources tab at the top right, where we do run these webinars and offer blogs as complimentary resources. So please do go to those sites. But again, thank you, Anne. Thank you, everybody who took part today, and have a great rest of the day.
Thanks, Mark. Bye, everybody.